Hello, my name is Oonagh Giggins and I'm an ECME Research Fellow from Netwell Casala in Dundalk Institute of Technology. And today I'm going to present to you our work in which we're developing and evaluating a digital health platform to support cardiac rehabilitation in the home. So we're all well aware of the problem that cardiovascular disease presents to society. It remains the #1 cause of death globally, with the prevalence ever increasing due to population growth and ageing. The effective management of those with cardiovascular diseases presents a significant challenge to healthcare systems globally. Cardiac rehabilitation is recognised as a core component of cardiovascular disease management, aiding in the recovery from a cardiac event and helping to prevent further illness and mortality. Cardiac rehabilitation typically includes nutritional counselling, risk factor management, lifestyle modifications and education, as well as physical activity and exercise training. Active participation in the exercise training component of cardiac rehabilitation has been shown to be an effective tool in reducing all-cause and cardiovascular mortality. Traditionally, cardiac rehabilitation programs take place in hospitals, with the patient attending as an outpatient. But despite the reported benefits, the rate of participation in cardiac rehabilitation exercise programs are remarkably low, as many patients face barriers to participation. Home-based cardiac rehabilitation has been advocated as an alternative and has been shown to be as effective as hospital-based cardiac rehabilitation. The coronavirus pandemic has also had a severe impact on the delivery of cardiac rehabilitation, with many services forced to move online. However, the problem with home-based rehabilitation and online classes is that it's often unsupervised and the clinician has very little control over how the patient is exercising and at which intensity. So this project seeks to develop and evaluate an interactive digital health platform to support people with cardiovascular disease as they participate in a cardiac rehabilitation exercise program in their own home. A custom digital health platform is being developed, which will consist of a mobile application and digital devices connected to the application. The platform will be integrated with the CABI SIM system, which will be used by the platform to collect and store the data that is collected from the application and devices. A pragmatic randomised control trial will be conducted to evaluate the efficacy of the digital health platform. This trial will evaluate the acceptability, feasibility and safety of delivering cardiac rehabilitation exercise classes virtually to people in the home. We will also evaluate the effectiveness of the digital intervention in terms of cardiopulmonary exercise capacity, muscle strength and balance, as well as in terms of health, well-being and quality of life. Ethical approval to conduct this study has been sought from the DKIT Human Research Ethics Committee. Once this ethical approval has been granted, we will then commence recruitment of a sample of convenience of participants who are eligible to take part in community-based cardiac rehabilitation exercise classes. Enrolled participants will be randomly allocated to one of the two study groups. So both groups will perform the same exercise program, which will consist of twice-weekly exercise sessions of 60 minutes over an 8-week intervention period. Participants in the intervention group will partake in virtually delivered cardiac rehabilitation exercise classes in their own home, while participants in the control group will attend the research centre for their exercise classes. The virtual classes will be delivered using a video conferencing platform such as Microsoft Teams or Zoom. Participants in the intervention group will receive our custom digital health platform for monitoring of heart rate and other symptoms during the class, and the platform will also be used to facilitate self-management during the intervention period. Outcomes will be assessed at baseline, following the 8-week intervention period and at a 6-month follow-up. The primary outcome will be exercise capacity as assessed using a 6-minute walking test. Other outcome measures will include heart rate, blood pressure, weight, percentage body fat, blood lipid profile, balance, muscle strength and quality of life. Following the intervention, semi-structured interviews will also be conducted with a subset of participants to explore their experience of participating in the virtual exercise class and also their experience of using our platform. Recruitment for this study is due to commence in January, with the trial then commencing in the early springtime. So this concludes my presentation. I'd like to thank you for your attention, and I welcome any questions at the end of the session.